Hi, I'm Lynn Kettell-Slifer, family nurse practitioner and functional medicine provider at Health Partners LLC in Northeast Florida. And I wanted to speak today about COVID, updates on, where we're going with this, what the scientific data is showing us, and how can you as the individual maintain the safety of yourself, your loved ones, and those around you. So we all know the numbers, I'm sure. We're all tracking the numbers. We're seeing that the World Health Organization just last week warned that the numbers are rising significantly worldwide. We're seeing that in the U.S. in multiple states since reopening. But at some point, we do need to continue on with our lives to some extent. So how can you arm yourself and those around you with protection? The first piece, and from a functional medicine perspective, is to maintain a healthy immune system. That means getting enough sleep. That means eating healthy. Certainly, many people take several of these immune building supplements, which we can discuss if you're interested in becoming a patient, but those are all things we can do to maintain health. Keep our disease processes under control if we have them, get good exercise, etc. So that's the first key piece, is a healthy immune system can fight off a viral infection. The next piece is we're going to be out there and we're going to be potentially exposed. So what can we do? Obviously, we now know this virus can live on surfaces for a great deal of time, days and sometimes weeks, depending upon the studies you're reading. So always washing our hands, being very cautious when we go to the store, wearing gloves if we can find them. I even wear garden gloves when I go to the supermarket because our practice has had difficulty finding exam gloves, and so I don't want to waste them. And so very much washing your hands constantly, your kids having them wash their hands constantly, and social distancing is another huge one. We say 6 feet. Studies show that if someone is coughing or sneezing, those particles can travel as far as 12 or 15 feet. So 6 feet isn't this kind of be-all, end-all. Avoiding large crowds to the extent that you can, and maintaining that social distancing. Now, newer studies are showing us that mask wearing is the be-all, end-all, if you will, as far as causing or preventing transmission in public places. I highly recommend that you wear a mask. This is just one of the myriad of studies that are coming out. If you're interested in getting an emailed copy of this, please contact our office. But basically they're saying if you wear a mask, if as much as 50% of people wear masks in public, that would reduce transmission of this virus by about 50%. Wearing masks is not a political issue. It is a sign of caring to others. It is a sign that you care enough about those around you to help spread or help prevent the spread of transmission of this. Now we talk about masks. So there are a host of different types of masks, and that can be somewhat confusing. The masks that are protective as far as preventing viral particles from being inhaled by the mask wearer are only the N95 masks, and these are a couple of examples seen here. The Chinese version of the N95 is the KN95, and these masks filter particles down to about 1 or 2 microns, which is the size that a viral particle would be. Issue here is difficulty in obtaining these masks. Our practice has had to reuse these masks for months now. I have been unable to locate additional masks. 6 months ago, you would have been fired for reusing this style of mask, but unfortunately, this is what we have now. There are, caution here, there are a lot of kind of knockoffs being produced with the numbers N95 or KN95 printed on them, and, be careful the source. General masks can be these surgical masks or some of the cloth masks, and some of them, like this one, have a filter insert in them. I'm not going to show you the inside because this is a reused mask, but some of them have a space to insert a filter. These are generally protective more for others from droplet particles if you cough or you sneeze in a public place. So they're more for the protection of others. They do cut down, if someone sneezes in your face, obviously they are going to cut down transmission to you. But it's all a numbers game. When you are exposed in public, how many viral particles have you been exposed to? You have to reach a certain number in order to be infected. But I advise very strongly that you wear a mask. Now, how do we wear these masks? This one, the simple surgical mask, and a lot of these have a metal piece to allow it to be fitted to your nose. So what we do is we loop these around the ear and we pinch them down to try to seal to the extent that we can, and we pull them below the chin. Now, I see this in public all the time. That's not protecting anybody. I see this in public all the time, and I don't know why you bother wearing a mask if this is how you're wearing it, but the best way is like this. So when you're in public, wear this mask. I suggest anywhere that there's a potential for exposure of someone, less than 6 feet away from you, or a stranger that you're not sure of, or if you're self-quarantining in your own house to reduce the risk for family members. So again, these are different options. I strongly suggest you avoid the N95s unless you are a healthcare provider, because again, we still can't get them, and I think it's extremely important that we protect the health of our healthcare workers for the resurgence of this pandemic, which is currently occurring. So those are just a few words of advice on how to protect yourself and how to properly wear one of these masks. How do you sterilize it? You can sterilize it by using a UV light, which are also hard to come by. They're potentially being outside in the sun, sitting them out here in the Florida sun during the day. You want to avoid moisture building up in these masks, because moisture buildup can definitely cause all kinds of germs and bacteria to thrive, and then you're giving yourself yet another infection. I see people hanging these on their rearview mirror in their car, which is probably a good thing to do, especially in the heat of the summer, because the masks can be sterilized simply by the heat of the car and the sun. So any questions, give our office a call, but I think this is really, really important, and I strongly encourage you, no matter what your political affiliation, to wear a mask, because the virus is not Democratic and the virus is not Republican. It doesn't much care. I really, really want you to be safe and be considerate of your family members and your neighbors. Thank you.